Hypertension, the silent killer. It's quiet, but it's deadly. No symptoms, no warning, yet it silently damages your heart, brain, and kidneys every single day. Globally, 1.3 billion people are affected. Shockingly, 63% are unaware they even have it, and many find out only after a stroke or heart attack. But here's the good news. You can lower your BP naturally. Let's explore 8 science-backed strategies that actually work. 1. The DASH diet, or dietary approaches to stop hypertension, is the most clinically proven dietary strategy to lower blood pressure and is recommended by major health organizations including the AHA, ESC, ISH, and WHO. This diet emphasizes the consumption of vegetables, fruits, whole grains, and low-fat dairy, while limiting saturated fats, processed foods, and excess salt. According to studies published in NEJM 1997 and JAMA 2001, the DASH diet can reduce systolic blood pressure by up to 11 millimol. Remarkably, it begins to show results within just 2 weeks, even in individuals who do not have diagnosed hypertension. 2. Reduce salt intake. Small cuts can lead to big drops in blood pressure. Most people consume twice the recommended amount of salt each day, silently increasing their blood pressure. The target, according to WHO, is less than 5 grams per day, roughly 1 teaspoon. Reducing salt can lower blood pressure by up to 6 mm in people with normal readings and up to 10 mm in those with hypertension, as shown in the Cochrane Review 2021 and BMJ 2020. The catch is that about 80% of our salt intake comes from packaged, restaurant, and processed foods, not from the salt shaker at home. 3. Move more, sit less. Even 30 minutes a day can shift your pressure down. Regular physical activity boosts nitric oxide, reduces vascular resistance, improves mood, and lowers stress hormones, all helping your blood vessels relax. You can expect a 4 to 9 millimol drop in systolic BP if you're hypertensive. Aim for 150 minutes per week of moderate intensity exercise like brisk walking or cycling. You don't need a gym. Just start with what you can do, consistently. 4. Boosting potassium intake is a powerful yet often overlooked strategy to lower blood pressure. Potassium helps by promoting vasodilation, enhancing sodium excretion through the kidneys, and improving arterial compliance, all of which support healthier blood vessels. Top dietary sources include bananas, oranges, spinach, sweet potatoes, and coconut water. According to the New England Journal of Medicine 2021 and WHO guidelines, increasing potassium intake can reduce systolic blood pressure by up to 5 to 7 millimol. 5. Prioritizing quality sleep is crucial for maintaining healthy blood pressure. Normally, blood pressure dips at night, a phenomenon known as nocturnal dipping. Poor sleep disrupts this pattern, contributing to sustained hypertension, and is associated with elevated sympathetic activity and cortisol levels. Simple habits like keeping a consistent sleep schedule, avoiding screens an hour before bed, and ensuring a cool, dark sleep environment can make a significant difference. Improving sleep alone can lower blood pressure by around 4 millimol, as supported by JAMA Cardiology 2019 and AHA 2021 guidelines. 6. Limiting alcohol intake is essential because even moderate drinking can raise blood pressure. Alcohol increases sympathetic nervous system activity, promotes vascular inflammation, and disrupts both sleep and hormonal balance. According to guidelines, safe limits are no more than 2 drinks per day for men and 1 for women. Reducing alcohol consumption can lead to a systolic blood pressure reduction of 4 to 6 millimol, as shown in studies like Lancet 2020 and the AHA 2017 guidelines. 7. Lose weight. Even a 5 kg drop can significantly lower your BP. Why it matters? Because excess weight increases the workload on your heart and raises vascular resistance, making blood pressure harder to control. For every 1 kg of weight loss, systolic blood pressure can drop by around 1 mmHg, and that adds up fast. It's one of the most effective lifestyle changes for managing hypertension. The key? Focus on sustainable, gradual fat loss, not crash diets. That means mindful eating, avoiding processed foods, and staying active with daily movement. 8. Managing stress is crucial because chronic stress silently elevates blood pressure by activating the sympathetic nervous system, increasing cortisol levels, and raising vascular tone. Proven strategies like deep breathing, box breathing, yoga, meditation, nature walks, digital detox, and mindfulness-based stress reduction (MBSR) have been shown to lower systolic blood pressure by up to 5 to 6 mmHg, according to evidence from JAMA Internal Medicine and Circulation 2021. You can lower your blood pressure naturally. And yes, it really works. The DASH diet, salt restriction, regular physical activity, a potassium-rich diet, prioritizing quality sleep, stress reduction, limiting alcohol, and perhaps the most impactful, losing 5 to 10 kilograms of weight may reduce systolic BP by 5 to 20 mmHg. Together, these changes can lower blood pressure by as much as 25 to 30 mmHg, comparable to medication. Start small, stay consistent, and take control naturally.